Hi guys, thanks for joining us again. Today, or you guys get to experience who is my worst patient here that I usually, have to adjust. And no, I'm just kidding. So this is my wife Amber. So she does get regular adjustment too. So, but anyway,
I don't know about regular.
well, she does get adjustments, So I didn't say she was a good patient, right? So she doesn't really
It's really
usually
my fault, yeah.
follow, doctor's orders too well. But she's not the only one. But anyway, today we're going to be addressing Amber's upper back and neck issues. She does have on and off, headaches, typically in form of tension headaches. Most of her issues is from the diminishing rotation on the left side, so we're going to try to release that area for her, and then kind of walk you guys through on how we help with tension headaches, and at the same time release a lot of the upper pressure, the upper back region here. So she does sit at a computer a lot, working on billings and insurance and so on. So we're going to pretty much hope to release her upper back when we have her laying on the table. So let's start with the neck first. So
I
again,
think my
sit up nice
tension
and straight.
headache is probably from you. Just saying.
That could be. I can't deny that. So let's have you go to the right side first for me as far as you can. And go to the left side for me, please, as far as you can.
Mhm.
Look straight for me and bend to the right side for me. And bend to the left side for me. So as you guys can see here, bending to the left is a little more diminished, and at the same time rotating to the left is slightly more diminished. The rotational components of the neck should be about 80 degrees, which is where your nose should be slightly just short on off, where your nose is about above the top of the shoulder cap right there. Now the 80 degrees actual range of motion is normal. It doesn't matter if you're 25 years old or 75 years old. Most people think that should be diminishing as you start to get older, but most of our patients that we work on, when they approach even up in their later years until their 70s and so on, they still retain an 80 degrees or more range of motion. Now, the only caveat with that is that, again, if people have a lot of arthritis in their, because again, some people do, because sometimes we have a patient that comes in when they're 65 and 70 and they've never been adjusted before, and they've had a lot of injuries in the past, and typically, again, they're going to have some arthritis here, that comes through, and what happens is the arthritis will throw bone spurs, and the bone spurs will diminish the range of motion. And again, you cannot reverse arthritis. So again, if they have arthritis that only allows them to go to just say 55 degrees, then that's as far as we can take them. So so this brings us to the utmost important that health, particularly in the spinal health, is about prevention. It's not about waiting until you get arthritis, because when you get arthritis, again, or degeneration, what you have is what you will keep. And again, sometimes they can go in there with surgical intervention, and they can clean that portion out. But again, your disc is still going to be degenerating. You might have less bone spurs, but you're still going to have degeneration of the disc. So I just want to touch based on that, just to help you guys, remember that prevention is the key. So to just Amber here, we're going to actually have her bend to the left side. So stay right there for me. Take a deep breath in for me right there, and breathe out for me, nice and easy. Good. Nice job. And let's have you rotate to the left side for me. Good. Go to the right side again for me, please. Look straight for me and bend to the left side for me, please, as far as you can. Good. So go ahead and stay right here. After we adjust it, we will be using some, I call it soft tissue mobilization technique. So using what we call PNF, PRR, PFS. They're basically different soft tissue mobilization techniques to get range of motion to increase on Amber after we work on it. So now we're going to put some pressure just to release this trapezius muscle, some of the supraspinatus muscle here, the scalene muscles here that's responsible for a lot of the tension here. And go to the left side for me as far as you can, all the way through. And nice job. Bend to the right side for me. Again, I can burn on some patient. They do experience some burning in the tendon here, especially when they're really, really tight. So that's what she's feeling right through here when we're trying to put pressure. Again, push against my hand here, please. And bend to the right side for me further. Nice job. Push one more time. And bend to the right side further for me. Nice job. Look straight for me and turn left for me now as far as you can. Good. Stay right there. And she's pretty much right about 80 degrees. So we're going to try to bring her a little further. Go ahead and push left against my hand here. Good. And go left for me, please, as far as you can. Nice job. Push left one more time. And go left again for me. And again, you can see with her shoulder back, So we don't allow any cheating, because typically when people oftentimes turn here, they think they're hitting 80 degrees, but their shoulder's all the way turning this way. Okay, so we want to keep the shoulder back and turn in head and neck, and you can see she's about 80 degrees right there. So now we're going to proceed to Amber's mid upper back. She does have a slight, can't really call hyperkyphosis, but she does have a slight, increase in the kyphosis or the curvature of the upper back. And typically what that comes through is, again, with sitting forward, rounding shoulder forward, sitting at a computer. So with her, we typically will address a lot of soft tissue muscle here. We're going to do some soft tissue release for her here. And it's going to be a little sore on her. So typically these muscles, they might not give us any active pain or pain at rest, but when we put pressure on them, they are really sore. Put a tender right there.
Mm-hmm.
Keep breathing for me. Good. Again, most people, they like light pressure, but I always tell all of my patients, you can't bring a knife to a gunfight, right? So if the muscles are really, really tight, you can't just put light pressure on them. You really have to put the right amount of pressure and a vertical compression, compressive load to release those tension. So again, we're going to do some release here. And sometimes you're going to get some intercostal joints that's going to be released on her. You heard one just released right there. Again, it's usually pretty painful for them. And good, but it's really, really worth it. Keep breathing for me.
All right, so question, my rib always pops out, so is that because I'm rounded over, or I don't have enough back muscles to keep it?
Typically it's both, so what happens is, her question is that if her intercostal joints sometimes is subluxated or pops out, what happens is when people are more flexible, or when they don't have as much strength or as much muscle tone, what happens is, or also too, some people just are bending forward more, and that also puts a lot of stress in those joints, and over time those muscles, they get fatigued. And typically when that happens, then your postural muscle are not holding you in as much, okay, or as efficiently. And then you have joints that can oftentimes get restricted or misaligned, and that's usually is the cause of some of these joints, becoming more misaligned on you. So typically it's a combination of one or two, or it can be multiple factors, and not just one factor for most people. All right, go ahead and take a deep breath from right there, and breathe out from there. All through nice and easy. Good.
Oh.
All right, take another deep breath from her, and breathe out from me, please. Sure. Nice job. Take another deep breath in for me. And breathe out from me. Yeah, sure. Good. Nice job. Good. And again, breathe out from me. And relax your shoulders from me. Good.
Oh, that felt so good.
All right, one more time. Take another deep breath in. And breathe out from me. Relax your shoulders from me. Good. Nice job. All right. Okay. Breathe up slowly for me.
I like that last one.
Yeah, that one was a good one, Anya. So,
That's
well,
okay.
thanks guys for joining us. Please let us know what you guys think, and anytime you guys have any question about what topics that you want us to discuss, please let us know. Thanks.